the humerus, suppose, and this muscle, the teres, this muscle is teres major, okay? Yes, and that is going, because I said intertubercular sulcus, medial surface of the intertubercular sulcus. So where is that present? That has to be present on that side. Is cut. Yes, so that can't be present behind. So this muscle is, suppose this is how teres minor is present. Okay, suppose this is how teres minor is present. This is suppose the scapula portion, and this is suppose the humerus present over here. So this is the humerus and this is the scapula. So this is how teres minor is present. Teres major is present in this manner. So this is going in this manner. So humerus's backside is minor and humerus's front side is major. So both of them, they are present in this manner, the two muscles. Understanding? So yes, it's in the medial lip. Now, can anybody tell me what should its function be like? Okay, Prithvi, do you agree to this? Okay, Prithvi, do you agree to this? Adduction and okay. Yes. So this time, Namrata, like Prithvi has said, if this is present in this manner, and if this thing is going like this, so how do you think it will pull it? It will pull it in this manner, isn't it? Yes, this is going to get rotated in that direction. So there is going to be medial rotation, and also there is going to be some, of course, adduction. Yes. Understood? Now, the next muscle that I talk about, okay, now, huh. Well, see, first of all, now it's easy to remember. Remember teres minor? Where did we? What did we learn? We learned that it is going and attaching to the inferior facet of the greater tubercle. It is attaching to the inferior facet of the greater tubercle. Now, next thing comes up is the middle facet of the greater tubercle, and this is how you should remember. You should go step by step. Over here we have learned inferior facet. Automatically in your mind the question should come up that acha, if this is inferior facet, then what should happen in the middle facet? So it's very simple thing. In the middle facet, you will see that there is present a very big muscle. Do you see this spine? We have learned previously the region beneath the spine. What is this entire region called as? Very good. So this is infraspinatus fossa, and over here, this entire portion, you will see that there is a muscle present, and this muscle is going to attach to the middle facet of the greater tubercle of humerus. So what should the name of this muscle be? Correct. So this is infraspinatus muscle. So if this is infraspinatus, can you tell me what is the function? What should be the function of infraspinatus? Okay. Prithvi, do you agree to this? All right. So its primary function is adduction and lateral rotation. So more important, which one should be more prominent function? Okay, that is which rotation? Medial or lateral? Who is acha? Prithvi is having some connectivity problem. Acha. Once we have discussed about this infraspinatus, Now in a sequence, again, once again we have to remember in this way. Number one, two things. See, number one, infraspinatus is done. So which area is left? This area is left. And over here we have discussed greater tubercle, inferior facet we have discussed, middle facet we have discussed. What is left? Superior facet. So now you understand. So common sense, what is the name of the muscle? Very good, supraspinatus muscle. And what should be the attachment origin point should be? Correct, supraspinatus fossa. And the insertion point should be? Brilliant. Yes. So this is the region. You will see this muscle. Now I cannot make you see this portion because that's hidden behind the spine and the acromion process over there, but it is directly attaching over here. Directly attaching over here. Understanding? So this is the primary function. Sorry. So once again, what is the function over here? What is the prime function? All right. It is, you are saying it is lateral rotation. Now, just a second. You are thinking it like a rubber band, right? See the direction of the rubber band, how you have put the rubber band, how you have attached the rubber band. Think on that once. Exactly. And from where it is going? It is, if this is the humerus, if this is the head of the humerus, so this is the head of the humerus, this side is the scapula. Till now every muscle was going like this. So somebody was pulling it in this way, so somebody was pulling it in this way. But this muscle is going and it is holding like this. It is holding like this. So how do you think this movement will take place? If you are saying lateral rotation, yes. So you can say that this will help in abduction. But don't you think that it is too close to the hinge for this abduction? So do you think it can perform abduction very properly? No. That means which muscle primarily helps in this abduction process, Primarily. Most important muscle to help in abduction. There is one muscle, okay? I'll show you. Imagine I draw this from the front side this time. How to draw? Over here you are supposed to see this is a coracoid process, and this is a suprascapular notch, and this is going to be the medial border and the lateral one. I'll make it a little bit aesthetically beautiful. So over here there is going to be the acromion process. What you must realize is that in front, over here there is going to be present the, do you remember this? Yes, over here there is present the clavicle, like this. And of course there's no fun in mentioning that this portion is the humerus. Now, the muscle that I'm going to discuss, this muscle is a very strong muscle. Why? Because it originates from the lateral third of the clavicle, acromion process, and the spine of scapula. That means it is going to originate from here in this portion. Understanding? Lateral third of the spine, then the acromion process, and the spine of scapula. And then where is it going? Now over here in the lateral aspect, there is present a deltoid tuberosity. Yes. So this muscle is going to go over there like this. So if you look at a person, suppose you are looking at this person from the lateral side. So how will this person, okay, I'll show it over here, suppose in a smaller picture. So this is going to be suppose this is the elbow portion like this. So the muscle will be seen over here completely. This is the muscle. Understanding? This, what is the shape of this muscle? Isn't the shape of the muscle like this? Triangle. So whenever you go to any region near the ocean where you see such type of triangular things, what do you call them as? Delta. So accordingly, sometimes we name muscles. If you read nomenclature of the muscle, you will see one method of nomenclature is its shape. So according to this shape, we name this muscle to be what muscle? Correct. So this muscle is known as deltoid muscle. So what is its point of attachment? Number one, the lateral third of the clavicle, then the acromion process, and also the spine of scapula. And it attaches over here to the deltoid tuberosity of the humerus. So can you tell me what is the function of this? Okay, very good. Number one is abduction. But over here, if you look at it more precisely, you will see that these fibers who are actually connected to the clavicle, do you think they are going to, this fiber, suppose imagine this fiber, do you think this is going to perform actually only abduction, or it is going to also perform something else? The ones which are present attached to this. Correct. So this clavicular part, it can perform rotation. What type of rotation? Correct. So this clavicular portion, it can perform medial rotation. And acromion portion, these fibers which are going to the acromion part, these fibers, the fibers which are going to the acromion portion, what can they do? Correct. So they are going to perform lateral rotation. How can they perform now? Tell me. You said lateral rotation. So how do you think they can perform lateral rotation? You are saying that such a nice idea that it is moving directly. So once again, it is moving like this, and you said it is going to perform lateral rotation. So how is it possible? Like high technology? I'm saying that this muscle, this fiber is moving like this, and it is attaching to the acromion process. And you said this is going to perform lateral rotation. So what will this perform? Correct. So this is going to perform abduction. That means these fibers, they will make my hand move like this. So these fibers, they're going to perform abduction. So, and what about the spinal portion? The spinal portion means the portion which is attached to the spine. What do you think they will do? The one which is present behind this. What do you think they will do? Yes, they are going to cause lateral rotation. So got this idea clear? Huh, from the spine, if it is coming and attaching over here, okay, from here, it is coming and attaching over here. So if that is getting pulled, so how will your humerus rotate? Is it very difficult or it's simple? Okay, okay. Now, once we have discussed this, now comes up another easy aspect. Over here, suppose I cut a little bit of portion just for our understanding purpose. I'll cut a little bit of portion. So let these fibers go like this. These fibers be like that, and these fibers be like this. So, can you tell me what is this? If I cut the muscle fibers over there, so you'll be able to observe this thing. Can you? Yes. So basically, this projection is the lesser tubercle, right? Now, you have told me this is the infraspinatus fossa. This is the supraspinatus fossa. So now, can you tell me what is this thing? This area? Correct. This is a subscapular fossa. So over here, if I make some muscle who is present completely over here along the subscapular fossa, and directly it is going to go and attach to the lesser tubercle. So what should be the name of this muscle? Correct. So the name of this muscle is subscapularis. So if you have understood this, can you tell me what should be the function of, come on, this at least you should say in one chance correctly. What should be the function of this thing, subscapularis? Correct. So its prime function is medial rotation. Okay. Not again, because again the same thing is present too close over here. So understood this part? Right. So that means what have we learned? If I draw this as the glenoid cavity, this is the infraglenoid tubercle, and this is the scapular portion. And over here, suppose this is the acromion process, and over here in this portion, this is acromion process means this is the back side, and this is going to be the front side. This is the coracoid process. So now you are supposed to think and you are supposed to tell me from whatever we have discussed till now. If I say, and think logically, it's very easy and it's very simple. If I say this region, okay, if I say this region, there is a muscle. I have actually cut it over here, okay, I have cut it like this. I have removed the humerus. So what you saw that over here there is one very big piece of muscle. Okay, this is a very big piece of muscle which is present over here. Are you understanding that I have taken a cut part? So what should be this muscle? Do you have any idea? Simple. I have, suppose imagine the section is very simple. Imagine that I have been holding your hand. Okay. So you are standing over here. I'm holding your hand like this, and then what I do is I put my leg on your abdomen or thorax region, and I like completely detach the huh. So what happened after that? The humerus got dislocated, but what happens? It was not coming out because muscles were like attached over there. So what I did, I took a knife and cut. Okay, I cut all the muscles from every direction, and then I took the humerus and threw it out. And then I'm staring at your scapula. Okay, right? So one such muscle should be present over here. So what should be this muscle? Think in this region, what muscle was attached? Middle portion. So this becomes so till the middle third over here, this is going to be the teres minor. Major should have been more bottom. Anyways, so and this muscle is going to be this one, subscapularis. So can you see something which matches with this? Yes. So remember that four scapulohumeral muscles, okay, four of these scapulohumeral muscles. I said four of scapulohumeral muscle. You know why? Because over here I haven't spoken about teres major. I haven't spoken about deltoid, isn't it? These are the scapulohumeral muscle, or also known as the intrinsic shoulder muscle. Okay, they are also known as intrinsic shoulder muscle or scapulohumeral muscle. So four of the scapulohumeral muscles over here, that is supraspinatus, infraspinatus, teres minor and subscapularis, are called rotator cuff muscle because I told you cuff means it should surround. It should surround. So do you realize that this is surrounding this joint, this surround the glenohumeral joint, isn't it? Like a cuff. So you can say that these four are considered as rotator cuff muscle because they form a musculotendinous, you can say cuff. Okay, it forms this is a tendons of the muscles are present over here. So this form a musculotendinous rotator cuff around the glenohumeral joint. Okay. So can I say that all the muscles present in this? Can I say this? We cannot say this. What about supraspinatus? Can it rotate? Yes, correct. So remember this from like MCQ point of view, that all the muscles over here, okay, all the muscles over here except supraspinatus are the rotators of the humerus, or I can say all except supraspinatus are rotators of the humerus.